A sharp surge of flu has hospitals in England scrambling, and there's no clear peak in sight yet. In the week ending Sunday, the average number of flu patients admitted to hospital rose to about 2,660 per day, and NHS England says the rise is continuing this week. Officials describe the situation as the equivalent of 3 full hospitals busy with flu, with some facilities reporting as much as 1 in every 10 beds occupied by flu patients. There are concerns the total could exceed 5,000 admissions by the weekend, and similar increases are being seen elsewhere in the UK. NHS England's medical director, Professor Meghana Pundit, warned that this unprecedented flu wave is forcing the NHS toward a worst-case scenario for this time of year, stretching staff to the limit as they strive to deliver the best possible care. Hospital flu numbers reached their highest level for this season so far, based on data since 2021, which means the record would exclude the 2 most severe flu seasons of the last 15 years, 2014-15 and 2017-18. This year's early flu rise is tied to a mutated strain. While H3N2 remains the dominant variant, it carries genetic changes that have left the general public with less familiarity, and consequently, potentially lower immunity to this exact version. Norovirus, the vomiting bug, is also on the rise, with more than 350 beds occupied by infected patients. The situation comes amid a looming 5-day strike by resident doctors, now the term for junior doctors. There was still hope the walkout could be averted after Health Secretary Wes Streeting presented a fresh offer, prompting the British Medical Association to poll its members on whether to call off the stoppage scheduled to begin next Wednesday. Poll results are due Monday. Daniel Elkeles of NHS Providers, which represents hospitals, commented that the NHS is navigating a major storm early in the season. He emphasized the need for every available clinician to help and urged the BMA resident doctors to accept the government's proposal and end the dispute to avoid further disruption. UKHSA data, which blends community and hospital infection levels, indicates community-level flu activity is still rising, though not as steeply as the previous week. Officials caution that it's too soon to declare a peak. Flu can be unpredictable, with lull periods followed by renewed surges. Dr. Conall Watson of UKHSA urged everyone eligible for a free NHS flu vaccine, older adults, people with certain health conditions, and pregnant women, to get vaccinated if they have not yet done so. He stressed there is vaccine stock available, but time to achieve full protection before Christmas is limited. It typically takes up to 2 weeks for the vaccine to reach its maximum effectiveness. Dr. Vicky Price, president of the Society for Acute Medicine, described winter viruses as aggravating an already stretched system. She noted long waits in A&E as staff deal with increasing volumes. Price also criticized NHS England and the government for using workforce shortages as a scapegoat for a broader, systemic failure that has left emergency departments under severe strain. Would you agree that the current pressures reflect deeper, long-term issues in NHS capacity? Or do you think immediate policy tweaks could still stabilize the situation in the short term?